afternoon everyone. I am Dr. Rashmi Chaudhary, the Senior Obstetrician and Gynaecologist in Cloudnine Hospital, Bellandur, Bangalore. I have a working experience of more than 26 years in the field of obstetrics and gynecology. My area of specialization is the management of high-risk pregnancy and the complicated gynec surgeries. Intrahepatic cholestasis of pregnancy is a unique liver disorder which typically appears in pregnancy and disappears 4 to 6 weeks post-delivery. This is characterized by intense itching in the palms and soles, which is a very irresistible desire of itching in this particular area. Sometimes also in the tummy, the mother experiences this problem, but there are no rashes. This itching is worse at night and is not relieved unless until we start medication. Sometimes these patients also have greasy stool. They pass darkish yellowish urine because of the affection of the liver enzymes. This typically occurs in the late second and the early third trimester. But in cases where the conception is by IVF or ovulation induction, it might appear little early. The cause is relatively not very clear, but mostly it is a genetic thing and because of the increasing level of the hormones like estrogen. The incidence is about 0.5 to 2%. So basically what happens in obstetric cholestasis? Normally our liver produces bile and it is stored in the gallbladder, and when we eat something, this bile is released in stimulation with the fatty food to digest the fat. In obstetric cholestasis, what happens, this bile is not getting released. There is a backflow of the bile in the liver, and from the liver it goes into maternal circulation. So the liver there is an increased level of bile acids in the maternal circulation, which is responsible for the itching and other symptoms. What is the impact of this? It has an impact on the baby as well as on the mother. The increasing level of bile acids has a significant impact on the baby's development, baby's outcome, perinatal outcome. Like it can cause premature contractions, these bile acids on the uterine interface. It can cause contraction and leading to preterm delivery. It can cause fetal bradycardia. It can cause deceleration of the baby's heartbeat. It can cause irregular heartbeat. Sometimes there is a premature rupture of membrane also. All these conditions leads to increased incidence of cesarean section, prematurity, and increased admission to the neonatal intensive care unit. To the mother, it causes preterm delivery. It can cause severe postpartum hemorrhage because of deficiency of the vitamin K dependent clotting factors, and increased incidence of instrumental delivery as well. So what is the management? We treat these women. We diagnose the condition with the level of the bile acid estimation and the liver function test, and we treat them with orthodeoxycholic acid and certain antipruritic agents and the dermocalm lotion, which gives a soothing effects to their itching parts of the body. With the management part is very important from the gestation point of view. Like after 37 weeks, 38, we deliver the baby. Before that, we do the intense monitoring and active monitoring of the baby's health status by the repeated ultrasounds, the non-stress test, as well as we educate the patient to manage the fetal movement count. They should maintain an adequate fetal movements count. If they are not observing that, they should report back to the hospital and we do the timely intervention to get a good perinatal outcome.